Now, the Western Cape government has expanded its COVID-19 testing criteria so that anyone who is asymptomatic may be tested, and the expanded testing criteria will allow the government to have more accurately track and manage infections in the province. For more on this, I'm joined now by Western Cape Premier Alan Winde. Premier, good evening, and thank you very much for joining us on the news feed late night. Now, as infections decline and pressure on the health facilities is reducing, what is the objective of expanding this testing criteria?
Of course, we must learn from what's happening in other parts of the world. We're seeing second waves. So we need to really understand what is happening across our province. We've got wall-to-wall, what we call hotspot management. We have teams in every district municipality as well as in sub-districts in the city of Cape Town. And we restricted our testing, at the height of the pandemic because we didn't have sufficient testing capacity. We then also made sure that we allowed other provinces to utilize that testing capacity when our numbers started to decline. But now we've got to make sure that we don't allow further outbreaks. And so now we've opened up our testing, so anybody with symptoms can go to any of our facilities and have a test. We will mandatory test everyone in our hospital that's going in for an operation, for any medical procedure. We will also do tests on all deaths that are outside of our health system. In other words, if you die at home and you had some symptom or something that could have said you might be, or there'd be a question mark on the cause of death, we will do a test. We will also test all of our health workers now even more regularly because they still are the front line. And we will also now start testing people even if they have had the virus, have been positive, but 90 days past them having the virus. We will also, if they develop any symptoms, we will test them again, not to assume that they have sufficient antibodies. Yeah. We also antibody testing that has been happening since the end of July, and we are also testing vulnerable areas in the wastewater treatment system because we can see if there's any rise in cases, and then the way that we treat it is if we pick it up, we zoom in on that area to make sure that we flatten that curve at the same time. We're now going back almost to pre-peak times when we used to call it bushfires. We'd go in, find out where the cause is. It could be a funeral, it could be at a school, it could be wherever it is. We will then test everyone, look at the testing and tracing, and flatten that curve.
And what is the approach that you're going to take to testing in prisons in the province?
If there's symptoms, we're very happy to test. We need to understand if there's any outbreak anywhere, we need to be managing it because we've seen we really want to stay ahead of the curve, and we also want to make sure that we don't end up with any enabling environment for a second wave. We're trying to get the economy now going up and running again. I think the last thing in the world we'd want is to be sort of starting to lock down again. So we really have to take it very, very seriously, continually messaging, and testing and tracing is the basic principle of how you understand where the virus outbreaks are happening and as a management tool.
I want to say in metro areas, it probably would be much quicker because there are plenty of testing centers there. What is your strategy for non-metro areas as far as making these tests available?
Of course, we have put up, we've still got our extra beds in place in our non-metro areas. We're using all of our healthcare facilities, and we've got some areas still with our sort of field hospital type testing facilities in tents joining some of our clinics and hospitals, and they will remain in place. And then also, if we have to zoom into any specific area, we will zoom in and go and test in that specific area, even if they don't have the necessary the clinic facilities, etc., because we need to be very vigilant, I think, over the next couple of months.
Which tests are you going to be using, Premier? We've heard that the rapid test is now going to be made available in South Africa as well, which could give you results within hours.
We're not there yet, but as soon as it does become available, we will use it. We will also use it, of course, at our economic hubs. But at the moment, we're still doing the standard testing, and we are also doing the serology testing or or the antibody testing that we've been doing since the end of July.
Yeah. Does this mean we can now let down our guards? I mean, we've been seeing those numbers going down, and you're upping your testing. Is everything now okay in the Western Cape?
Definitely not. We must make sure that we know what to do. I mean, this is behavioral change. We need to keep wearing our masks. And I know it's difficult, but we've got to do that. We need to make sure that we keep the social distancing. We need to make sure that, we all know what to do. Wash our hands using the sanitizer. At the moment, we are watching what's happening in other parts of the world. And even in some of our rural areas at the moment, Beaufort West is our, although low numbers, but they are our highest infection rate in the province, followed by Matsipama up the west coast and Knysna in the Garden Route. And so we need to make sure we monitor these towns. They might be low numbers, but still, if we don't get on top of it, these numbers, as we've learned in the past, can climb very quickly. So we have to remain vigilant, very, very much so. In actual fact, some of our rates per 100,000 are more than some of the countries that we're seeing locked down now in Europe, and some of our numbers per 100,000 in some of these small rural towns are higher than that. So, although generally we see all the numbers coming down, even 30 cases in a small town takes your per 100,000 case number right up. So we've got to be very vigilant. And I know that people want to relax, but we've definitely got to make sure, learn the lesson from the Northern Hemisphere. They all like closing down again. It's the last thing our economy needs.
Alan Windy, appreciate your time. Thanks for joining us tonight on the Newsfeed Late Night. That's the Premier of the Western Cape.